So You Want to Change the World, a podcast sponsored by the UNLV School of Public Health. This podcast is designed to highlight some of the outstanding work of our faculty, staff, and students, and how public health changes our world, our community, and improves our quality of life. Well, hello, I'm Shawn Gerstenberger. I am Dean of the UNLV School of Public Health, and thank you for joining us on another one of our podcasts, So You Want to Change the World. Today, I am thrilled to have with us our guest, Holly Lyman. She is the Director of Community Health at Dignity Health, St. Rose Dominican, and she has a lot of connections to the School of Public Health. She's an alumna, got our Master's of Public Health degree from us, was our Alumna of the Year in 2017 for some of her outstanding work, and she has really worked in our community to change the world in so many ways that we're excited to hear about today. Part of her work she's done for the last 30 years is designing and implementing prevention, screening, and disease management programs that have literally helped thousands of people. So great to have you here today, Holly, and welcome.
Thank you so much for having me here. It's weird to be back on campus, right?
It's changed so much over the years.
It's changed so much since I've been here.
It's awesome.
But also, happy National Public Health Week, right?
It is Public Health Week, for sure.
I was going to bring donuts, but I don't think that's appropriate.
Maybe not for Public Health Week, right? Well, you have a big title over there as the Director of Community Health. So maybe you could tell us a little bit about what that entails. What are some of the programs you oversee and some of the work that you do there that represents your degrees in the school and the university?
Well, I have the best job in Southern Nevada. I am the Director of Community Health for Dignity, as you said, and I have 6 community health and wellness centers in the Valley. We're building our 7th center, and they're all there to serve the community. So we have hundreds of programs. It was really hard to pick which programs I wanted to talk about. It's like choosing your favorite child, but our programs range for all ages, from pregnant mothers to healthy aging. And our ultimate goal is just to keep people out of the hospital. I mean, I know that's weird for a hospital to say, but we want people to be healthy in their neighborhoods and healthy in their homes.
Well, that's awesome. Obviously, kind of the mantra of public health is promote, prevent, and protect. And so obviously you're living that out every day. And so I would love to hear about a little more details about some of that work that you do in one or two of those programs. So most of us have had kind of something in our career or in our experiences that kind of changed our lives, that made us realize this is what I was meant to do. Do you have any of those types of stories you might want to be able to share with us? Yeah.
So a couple of my favorite programs are, one of them is the Helping Hands of Henderson program, and that's where we drive seniors around in little vans, little minivans. You've probably seen them all over town. We drive them to doctor's appointments, to the pharmacy, wherever they need to go. And this is vital because seniors are healthier when they're in their homes. But when they can no longer drive, they still need to get to all their appointments. So we provide about 7,000 round-trip rides a year with these little teeny vans just driving seniors to doctor's appointments. And sometimes, the saddest thing is sometimes the only person these seniors even see is our driver. So it really helps them to stay connected. We try to provide other resources when the driver is with the client, but we're really proud of this program. And during the pandemic, obviously, people weren't going to the doctor, but we opened a food pantry and we provided 1,400 grocery deliveries with those little vans and drivers, kept them busy.
That's awesome.
To seniors who couldn't get out at all. So we're super proud of that transportation program. We know in public health, if you don't have transportation, you're not going to get to where you need to go to stay healthy.
For sure. I know in those seniors, just some of the things we take for granted are not easy, right? So, just jump in your car, run down to the store.
Run down to the Walmart.
Right. Get a bag of potatoes, a gallon of milk, tuck it under your arm and come back. That's not a realistic thing for them, or to get to the doctor's appointment if they're not feeling well. So, I mean, those are incredible things that really do impact lives. I have some aging parents, and these are some of the things that we're working on right now to make sure they have access to fresh food and access to transportation and other key things. So I know you have tons of programs, and this is just one. I think it speaks a lot to the broad spectrum of work that you can do with a public health or a healthcare administration degree. So are there any other programs in there that you'd like to tell us a little bit about that, really when you get up in the morning, you're just proud of?
Mm-hmm. Yeah, I think access to care is one of our biggest priorities. Having people know how to navigate the most complicated healthcare system in the world, in my opinion, is really important, because if people don't know where to go or what to access, then they're not going to be healthy. So we do a lot of access to care programs, and a couple of those are the Medicare Assistance Program. Last year we helped over 8,000 Medicare beneficiaries navigate the complexity of Medicare, which I don't know if you know. I'm sure you know a lot about Medicare. It's very complicated.
Right.
And then we have a whole population of uninsured in Southern Nevada, so we help them enroll in Medicaid or a Nevada HealthLink health plan. And then we navigate them how to get to a primary care doctor. What doctors can you go to? Where do you enter healthcare, and how do you get all those preventive screenings? So that's something we're very proud of as a hospital, is helping people stay healthy by accessing that preventive care before they hit the hospital.
Those systems are complicated to navigate. Period. Mm-hmm. And, imagine if you don't have a computer, or you don't have access to the internet, or you have a little trouble seeing, right? Or things like that are not horribly uncommon, unfortunately. So being able to get them access to care, access to a provider or a specialist is huge. I mean, it can make the difference between life and death, literally.
Oh, absolutely.
For some of these patients. And, we have healthcare system in place that is able to accommodate them and assist them. But if you can't figure out how to get into it, it doesn't do you much good. Mm-hmm. So I know in the intro I said tens of thousands of people. That's maybe a little bit of an underestimate. That's a little underestimate. I think I lowballed you on that. I didn't mean to. But, right there alone in these first couple of programs we've talked about already, there's thousands, tens of thousands in those. And those have been going on for years and years and years. They're not new. So it's literally hundreds of thousands. So I apologize for lowballing you on the estimate. But so maybe a little bit about you, right? So obviously you're proud of your programs and you're proud of the people that manage these. But when did you kind of know? When did there flip a switch that said, public health and helping others and managing these systems? Is there a person or an event or a place that kind of a switch flipped and you said, this is it, this is my career, this is my path, this is what I want to do?
Well, you've met some of the Adrian Dominican sisters. I think you know Sister Katie and a few of the other sisters.
Yep.
And, when I got the job at Dignity Health, it was quite a culture shock, because I came from a Fortune 500 healthcare company. To come into the arms of the sisters was amazing. And I remember that first day in orientation with Sister Molly, and it hit me like a ton of bricks. Like, this isn't a job. This is a ministry. This is a mission. I'm on a mission now. And to take that responsibility from the sisters and, really care for this community is something I'm very, very proud of. And I got to tell this story about the Adrian Dominican sisters. I know you might have heard it. Maybe.
But it's fascinating.
But it is fascinating.
It is fascinating.
So the Adrian Dominican sisters are from Adrian, Michigan. And they were called to come and take over the old basic magnesium hospital after the war was over. They were going to shut that hospital down in little corner of Henderson. So 7 Adrian Dominican sisters jumped on a train from Michigan, got here to Las Vegas in June of 1947, 75 years ago. They got off that train in full black woolen habits, found their way somehow to Henderson, middle of nowhere, and immediately started delivering babies. I think the next day they were delivering babies, cleaning the hospital, doing the administration. They were nurses. They took care of the sick. They went out in the community, made it a better place. And when you think about that, and 75 years of serving this community just tirelessly, it is really inspiring. And their huge thing is to make people healthier. And so I really take that mission to heart. I think I've really found my calling. And to me, it's really important for me to carry on the work of these just absolutely incredible ladies.
Well, it's pretty awesome. One of the things I love about Dignity is their commitment back to the community, right? And so it's part of your mission and your vision, and you're required to report back out on that and be held accountable. And really, that's your job, right? You're the accountability steward to make sure you're doing all those things back into the community that are doing those things, promoting, preventing, protecting, improving the quality of life for those individuals that live there. And it's pretty awesome to see, because it's not like that everywhere. It's not like that every place you work.
Well, and I get to report back up to the sisters. So to me, it's important that we're carrying on their mission.
And I know they hold you accountable too.
Oh, yeah, they do.
Yeah, they're characters. They're absolutely
wonderful.
They're wonderful.
Yeah, and the coolest thing about the Adrian Dominican sisters is they have this spirit of joy, and you've met them. They're not your typical sisters. They're just so filled with joy. And one thing that they say is that they feel that joy is one of the closest experiences to God. And don't we all need more of that? I mean, you know,
joy doesn't hurt at all, that's for sure.
And so to carry that joy with you while you're doing this work is another really great thing.
Well, I think one of the greatest things that we hope to happen to students when they graduate is that they leave here with a skill set that allows them to do what they're passionate about. And so I know that you've got a degree from us, and I would love to know how that degree helped you to find your passion and to find your mission. And what did you take from this program that helped you get to where you want to be and where you are now?
Well, I love my MPH, and my undergrad was in business. So like I told you, I was at a for-profit healthcare company. So I was very, very detailed on, making money for our shareholders and return on investment and budgets. And so coming to Dignity was really wonderful. And that's what made me want to get my MPH. I was going to go to the MBA program. The hospital had an amazing MBA program. But I'm so glad I switched, and that's because you guys just launched
We're glad you switched too, yeah.
Yeah, you guys just launched your MPH at that time. So the timing was like, oh, I think I need to do this. But my MPH really prepared me in a couple of significant ways. The first one was, for so many years, like I told you, I've been focused on the business aspect of healthcare. But it completely changed my focus to understanding healthcare disparities, inequities, the environmental impact, the more really human kindness side of healthcare. And, I was in all Dr. Chino's class, and really learning about social justice was quite a switch for me.
Yeah.
I was a little learning curve, and I just have to say I apologize to any of my professors if I was ever insensitive or completely clueless with my ignorance, because I had no idea about some of that stuff. So to me, I think that's really important, to really learn about inequity in healthcare. The second thing is statistics was my most challenging class, but the grant writing, the outcome measurements have been incredibly valuable to me. I now have 28 grants totaling over $4 million that fund all these programs, hundreds of programs,
that's awesome.
and my 60 staff. So I now have 60 staff that are funded by grants, and I learned all that here at UNLV. So thank you.
Well, and I mean, that's awesome. And obviously that's one of the reasons you were the alum of the year, for all that wonderful work and the change in the community. Also, you continue to be actively engaged with students. You've been giving back in a lot of ways. I think one of the biggest ways you've been giving back is by continuing to take on our interns and giving them awesome experiences. So maybe you could tell us a little bit about what advice you might have for a student, thinking back when you were sitting in the library here a couple of years ago, and kind of how your thought process was to what it is now. What would you tell those students to do or engage in or try or to, kind of expand their horizon to think about all the different things you can do with a public health degree?
Well, I have to tell you, we love our UNLV interns. I think I lost count at over 100, so we've had, a couple hundred UNLV students during my career, and it's so fun when I get to hire them and just watch them just blossom in their careers. I currently have 6 former interns who are on my staff, and just a quick shout out to Mark Domingo, who is my current superstar from UNLV.
Right.
We hired him. He's now the manager of our neighborhood hospital wellness center, so super proud of him. But the students who have really thrived in at least my department have an amazing combination of that business finance grant stuff, but they have just huge hearts full of human kindness. They just want to serve. They just want to help. And those are the students, I think, that really find their niche in public health. But if I had to give any advice to someone, I'd just say jump in and start. Just take a class, start right away, because before you know it, you'll have your degree. I think it took me 9 years to finish my master's, and I was in your office like, I just need more time, because I had a couple kids. I worked full time. I had to drive down here to UNLV, like, oh. But now your MPH is online, so there's really no excuse. I mean, just take one class and see if you love it. And I have to say, one of my favorite classes was epidemiology with Dr. Bungham. And it's funny to think back on how fascinated I was with looking at all that, scurvy and all those interesting, the Broad Street pump and cholera, all that fascinating, how interesting it was. But, now it's not so interesting anymore. I think the pandemic has really been really eye-opening. And that master's level epidemiology class could never prepare you for living through a pandemic. So it was really probably no longer my favorite class, just to say, no offense to Dr. Bungham, but it was really interesting to really learn about epidemiology.
Yeah. Well, obviously, you never know which one of those classes you're going to need on any given day, but they're put together for a reason, right? Because they know your skills that you're going to need down the road. But we could not thank you enough for all of the wonderful things you have done since getting your degree, and to give back to UNLV, supporting our students. You mentioned to watch these students light up and try things and do things, right? I think one of the common themes that we always see in public health and healthcare students is they want to change the world, right? That's where the name of this podcast came from. I always joke it's public health folks are a bunch of chronic do-gooders, right? And we've been called worse things for sure. But, you don't know until you try. So get out and get those experiences. One of your many, many, many programs that all do different things to help people. And you often appreciate those more as you get a little older, like I am, as you see, those aging programs are really important, and I might need those someday. And so it's pretty incredible to see all that you have done and all that you're going to continue to do. So we thank you so much for sharing your experiences with us today and your insights and how to hopefully inspire some other students. It's great to see those students going over to your organization and leaving, and even hiring some of those, because I know you do that as well, and we appreciate that. So we hope these types of stories and these types of interviews get people excited about public health and healthcare administration, and really demonstrate how they can get out there and change the world. So if you want to learn more about us or any of our degree programs, thank you for the blatant shout out for the online MPH degree. That's online now as well. You can go to our website. Obviously, that is unlv.edu/public health, or you can always just stop by and visit us. We're on the 3rd floor of the Gateway building here on the UNLV campus, and we would love to see you. So stay tuned for future episodes with some of our amazing faculty, staff, students, community partners, alumni like Holly. And thank you so much for being here today, Holly. We appreciate you.
Thank you.